girls, of course, grow their pubic hair, and then they get breast development, and then they start thinking about their period, right? We start seeing some changes. Peer pressure starts very young. So this peer pressure can actually start even in like 5th grade. So even when they're like 10, it is unbelievable the amount of pressure that these children have nowadays compared to when we all grew up, the older of us, right? They're gonna get peer pressure to do alcohol. They're going to smoke. They're going to have tobacco products, even chewing. Even some girls can chew drugs and to have sex very early. And that's always very concerning to me, because we need to make sure that we reach out to these young women and these young men and talk to them about the problems that this can happen if they start giving into that peer pressure. I've talked to my kids a lot, saying, you know what, do your friends make good choices? And a couple of them say, no, they didn't make a very good choice, so I don't think I want to hang out with them. Very good. Good choices get you good things. Bad choices get you bad things. That's kind of how I raise my kids. They make their own choices about friends, sports, studying, school, computer time, TV time. They're independent. They are trying to fight for their independence. They know that they're still young, but they're still trying to figure out their way in this really harsh world. So the teenage brain, right? Love, they all love, right? But then they all can be a little ornery at times, a little frustrated. The ego, this little love for parents, hate for parents. Yeah, we've all experienced that, right, as parents, when we know. Body language, ooh, that's a big one for kids, right? Balance and coordination levels. Ooh, have you ever seen a boy growing start to run? It's cute. All right, so young teenagers, we call them tweens, ages 12 to 14, they're very concerned about their body image. They start looking around, they start looking at social media, they start comparing themselves to really unreachable goals. So we need, as parents, we need to make sure that we tell them, these goals are not always reachable. We want you to be healthy. We want you to be able to do some exercises, but not be super thin. We need to have a good relationship with food. They start looking at clothes, and they want to kind of start wearing these little more clothes that they probably shouldn't be wearing at that younger age. And I'm noticing that the kids younger nowadays are really trying to do that more. So we as parents need to be really good role models, and I know you ladies are, and even the friends of friends, like the young girls in the room, make sure your friends are doing those good role models. Make sure that they're covering things up that shouldn't be covered, that should be covered up, okay? They show interest and are very influenced by their peer group. Again, those friends make good choices. We need to make sure that they make good choices. They can show a little less affection towards us. And that hurts as parents, because we don't like that. It doesn't feel good, because they're our babies and we want to nurture them, we want to love them, but they're trying to pull back because they're trying to learn how to be independent. They may be a little rude or short-tempered. I never experienced this at all, right? No, my daughter, she stunted her growth a little bit. She had very, very severe anorexia. And Lillian, I don't even know if you knew that. She started after I graduated, and she got down to 87 pounds, okay? She's 5'7". That was very, very, very bad time in our lives. And she got a little rude and short-tempered, but she didn't understand what was going on. So it was a little frustrating to me, but it was also frustrating to her because she couldn't help it. So we need to make sure that we are, again, good role models, be very in tune to our teens, make sure that they're understanding everything happening with their bodies. They're going to feel stress now. Growing up, when I'm a child of the 80s, the 70s and 80s, we had a lot of stress, but we didn't have a lot of stress at the same time. Our stress was a little different, right? Now the kids have social media. There's a lot of ways that bullies can reach our children through social media. It's really quiet. It's roundabout. If you have a good relationship with your child, make sure that they're telling you, like, hey, how's your conversation going with your friends? Or make sure, as a parent, I demanded, sorry girls, passwords. I made sure that I had passwords to all their accounts so I could actually kind of keep an eye on what was going on. They didn't have a phone until they were 14 years old, and then I limited it, okay? Again, developing eating problems and eating disorders. This is a prime age. So just make sure that we're setting good examples. Make sure that we're watching very closely on how that they're doing and that their relationship with food is very healthy. And they can start to feel sadness and depression. They can lead to, like, The depression doesn't always appear like sad mood. Depression is not always just a sad mood. It is not concentrating, it's not sleeping well, it's not eating well. This can lead to the poor grades at school. So you're going to see a decline. If your child has some depression, they may not appear sad to you, but you're going to see this where they're not concentrating, they're doing poor grades, maybe they're making some bad choices. So that's the time to have that conversation with them and say, hey, what's going on? I just want to be here for you. Make sure that you're very open that to having those conversations. My children and I have a great relationship, and they've had some conversations that sometimes I kind of probably didn't want to hear, but I did anyway because that's what I wanted. I wanted them to be able to come to me with anything. So parenting tips. Boy, oh boy, teenagers are fun. So be honest and direct with your teen when you're talking about those sensitive subjects, okay? When you're talking about sex, when you're talking about drugs, drinking, smoking, all of that, just be very honest and open with them. Meet and get to know their friends. Get to know their friends, get to know their friends' parents. Doesn't mean you have to be a hovering parent, but just at least have them over, get to know them, watch them a little bit, just to make sure that they're making some good choices. Show an interest in their school life. My kids are all academic. My daughter was a little bit of a volleyball girl, but most of them did academics. I was at every academic competition they had. If I couldn't be, then my husband was. One of us was always there supporting them. They knew that they had that family support. Respect their opinions, and that's going to be a little bit harder because sometimes it's not our opinion. Okay, so we have to respect their opinions, take into account their thoughts and feelings. It's important to know that we're nourishing them to become adults, we're guiding them to become adults, and that we're actually listening to them and taking into account them. I had a hard time with that because I thought, my children are going to be just like me. Yeah, not so much. Not so much. When there's a conflict, this is the hard part. Be clear about your goals and expectations. So if the consequences, please follow through. If you don't do your homework, then I'm taking away your tablet for a week. Don't give in after 2 days. That tablet's taken away for a week. Because if you give in, it's going to send mixed signals because they're going to say, well, I can do whatever I want. Okay? Keeping things like the goals of getting good grades, keeping things clean, showing respect. But again, let them have some input on some of those goals. My daughter literally hated doing dishes. It was like pulling teeth to get her to do dishes. But she didn't mind doing the laundry. So I said, okay, that's your chore, then you can do laundry. So that way we had a good, nice conversation between us. So safety with teens, a lot of them don't really realize that they can be unsafe. They don't understand some of the safety piece of things. So make sure they know wearing seatbelts. Wearing seatbelts in a car is so important. I cannot begin to tell you, I worked in the ICU, I was working in open heart recovery, and how many teens, and I worked in the PEDS ICU as well, didn't wear their seatbelts, and they would come in a car accident and not be in great shape. So it's really, really important to make sure that they're wearing their seatbelts at all times. Again, vehicle crashes are a leading death among children because of seatbelts. Talk with them, again, about the dangers of drugs and alcohol. If you have a family history of alcoholism, let them know that. Don't put that under the rug. Make it known that there's a problem with alcohol in this family and we need to stay clear of it, okay? Talk with them about the importance of having friends who are interested in positive things. Encourage to avoid peer pressure. So one of my kids, she said, "Oh no, she's making really good choices. She's making really good choices." And come to find out, she really was not making good choices. But I did watch my daughter slowly back away from that friendship without me having to intervene, which was a pretty proud moment as a parent because I kept that open line of communication, and set clear rules when they're home alone. Having friends at the house, making sure they're doing their work. How to handle dangerous situations. What happens if somebody knocks on the door? That can actually be a very dangerous situation. My kids did not answer the door if I was not home, period. They just didn't do it. Fires, make sure that you have a fire plan. Make sure that you have a place to meet. So if you have a fire, we were to meet at our mailbox. Everybody got out, but we had a meeting place at our mailbox. So just make sure that they're very well of those plans. Teen and healthy bodies. Again, I shared with you my daughter had anorexia. It was a really, really, really hard time in my life, and she still fights with it, and she will her whole life. She's so much better. Thank you, God. She is so much better. She's lifting weights, and she's doing exercise. But this is really important to talk with our teens about their healthy bodies. Encourage physical activity. God meant for us to be moving. He meant for us to be active, right? So join a team sport or try even an individual sport like swimming or something along those lines where they can shine, where they can actually not, if they don't have a competitive nature, then they can do the individual sport. Golf is a great sport. Sometimes it's a team sport and sometimes it's individual. Helping with the household tasks, mowing the lawn, making sure that they're getting chores done, walking the dog. Mealtime is really, really important for families. After my daughter got out of the hospital, we made mealtime a very special time. We all sat down together. Everything was, all electronics were put down. And after we ate, we played games. We had fun times, just learning to kind of deal with mealtime. And we grew closer as a family. So that's kind of my thing is if you have meal times, so we're so busy. We're so busy nowadays. We have meals on the go so much. Several days a week, make sure you sit down as a family unit, and just talk about how your day went. Go around the table. Hey, what happened to you today? What are you thankful for? What bad happened? What can we help you with? Okay, there's a lot of things that maybe they're not going to tell you, but maybe they might, if they start talking about your problems, maybe your teen will say, hey, I am kind of having a problem with this. What is your thoughts? Okay. The amount of sleep a night for a teenager, 13 to 18, is, believe it or not, 8 to 10 hours. Okay, some teenagers, you're like, yeah, you're sleeping until 11. Wake up, okay? But my kids weren't very good sleepers, so I made sure that they had that 8 to 10 hours. Make sure there's a clear bedtime, and make sure that there's no electronics in their room. That will actually help them get to sleep better. And when I have a patient who has insomnia, the first thing I tell them is no electronics for an hour before you go to bed. None. That actually stimulates your brain. So I put my phone away, I set my alarm, put it down, and I start reading a book. Okay, that is huge for teenagers because then they get stimulated. All right, women's health. We're women. We have a menstrual cycle. Yay! So our menstrual cycle is our monthly bleeding. It's called our period, of course. When we menstruate, we discard the building of the lining in the uterus. So the uterus is where we grow our babies, and it grows a lining every month. Our blood is actually just shedding the lining of that uterus. Menstrual blood and tissue, actually, if you have that thick cycle and you have like, oh, what is that? That's just a little bit of tissue coming along with it that's attached itself to the uterus. During the monthly menstrual cycle, it builds up to prepare us for pregnancy, right? It's got to have a nice little nurturing womb there. If you don't get pregnant, then we have estrogen and progesterone that fall, and that's when we start shedding our blood. From the first day of our period is when our cycle begins. That's the first day. That's day one. When we have our next cycle, that's the end of our period. So usually the cycle is anywhere between 21 to 35 days, with the average being about 28 days. Most of them get their period between 10 and 15 years old. Again, the average is 12. There's not really a right age to get a period. Like I said, I was 9. I was a tiny little baby. My daughter was 16, so she was a late bloomer. Again, she's my daughter, and she did not develop the same way I did. Let's see, 3 to 7 days. So I was lucky and I was blessed. I had very short cycles. I only had 3 to 4 days. My daughter had 7 to 10, and she is not happy about it. Oops. Hey, back there. PMS. I've been compared to her. They say I look like her. So PMS symptoms, we've all had it, right? Where we don't feel so great. I mean, there's just times, swollen, tender breasts, constipation, diarrhea, bloating, gassy, headaches, just these horrible cramps. The reason I put the lower tolerance for noise or light, that was me. It wasn't a migraine, but I just had less tolerance for it. I got a little more agitated. Emotional irritability. Some of us can be pretty hostile, actually. Super tired. Sleeping problems, sleeping too much or sleeping too little. Trouble with concentration and memory. I had that a lot. It was terrible. Mood swings. Sometimes women get super depressed around their cycle. Less interest in sexual activity or more interest in sexual activity depending on your hormones. So treatment options. Exercise is one of the best. Okay? Exercise is one of the most underutilized antidepressants we have, actually. Versus, if some women don't want to take medications for depression, I tell people, please exercise. Please, please, please. It releases these natural endorphins in our bodies, and it just makes us feel so good. It can help with difficulty concentrating, fatigue. We want to choose those healthy foods. We all crave chocolate, right? Around our cycle, we're like, oh, give me that chocolate ice cream. I'd sit with a tub of chocolate ice cream on my lap. That was not a good choice for me, and I kind of dealt with that, and now I'm still fighting it. But we need to get the good choices of foods, like those fruits and those vegetables. Avoid foods with caffeine, like a lot of caffeine. So chocolate actually has caffeine in it. I don't know if you knew that. It's one of the big the symptoms of heartburn, too. So chocolate can actually make your heartburn worse. Lack of sleep is also linked, so I want you to get enough sleep. And that's really hard to do sometimes because we're moms, we're sisters, and we're daughters, right? So we need to take care of our bodies. Find healthy ways to cope with that emotional stress. Talk to our friends. Don't keep it in. If you're shy and you don't talk to your friends, keep it in a journal. I've been writing in a journal for my whole life just about, okay? Journaling is one of those great ways. If you're feeling stressed, you can go onto the paper and then close it. Or if you don't want anybody to read it, wrinkle it up and throw it in the trash, okay? It's just one of those that'll give it off your brain. Don't smoke. Don't smoke. There's a huge study that reported women had more severe PMS symptoms who smoked than who didn't smoke. If you're a smoker and you have really bad PMS, that's just another reason for you to quit, okay? And then what can we do to help ourselves? Over-the-counter pain relievers, Tylenol, ibuprofen, naproxen. Now they do have Pamprin or Midol. Okay, those have a little bit of caffeine in them because it takes away some headaches. But they do actually work for some bloating, so they're not so bad. Those are all over the counter and they're pretty natural. And then aging is not for the weak. It isn't. My mama did not tell me all about this stuff. Grr. So women, we have breasts, so we get breast cancer. October is Breast Cancer Awareness Month. It is a huge deal for me. I don't have breast cancer in my family, but I bet you at least 1 in 5 out of you guys know a family member who has breast cancer, right? It is scary stuff. So we're going to talk about menopause first. So menopause, it can start as early as 45, and it can last 10 years. That's a dirty trick. Are you kidding me right now? 10 years? It mostly lasts only about 3 or 4, and some people hardly ever go through any symptoms. Of my mom, she just coasted right through it, right? But I know somebody else, her mom, she was not a nice person through this menopause. I had a coworker whose hot flashes were so bad she would bring a second shirt to work because it was so bad. So you can't say you've been in menopause till you've had no menstrual cycle for 1 solid year. One of my best friends was getting married. She didn't have a cycle for 11 months and started. Oh, she was so mad because then she had to start it all over again. So during menopause, our production of estrogen and progesterone, they vary, but they start dropping, okay? So menopausal women they're very vulnerable to heart disease because of the low estrogen. We're very, very vulnerable as women to osteoporosis. That's that brittle bone. It gets worse as menopause. So when you hit age 65, guess what I'm going to do as a provider? I'm going to get you a bone scan. I'm going to get you a DEXA scan. I'm going to look at your bones. I'm going to make sure that they are healthy. We need to eat that healthy diet. We need to be active. And we need to make sure that we take enough calcium, okay? So for the optimal bone health, you want weight-bearing exercises. I take a calcium with vitamin D, so I take a Caltrate every single day. I probably have osteoporosis. I'm not 65 yet, but I had a hysterectomy. So I'm at very high risk because I really have no estrogen anymore. High risk for osteoporosis, and my mom and my grandma had it. So I take a Caltrate every day. The one thing about taking a Caltrate and any type of calcium, ladies, take it 2 hours apart from any other medication. That's kind of a big deal. A lot of providers forget that little piece of information. Calcium is a binder, right? So if you take your calcium with your blood pressure pill, what's the calcium going to do? It's going to give it a huge hug, and it's going to love on it, and it's not going to let it work. So if you're noticing that your blood pressure meds aren't working as well, think about if you're taking calcium with it. Tums is a really good source of calcium, and people don't think about it because they use it as an antacid. So I take my calcium with my lunch, apart from any meds. So what are symptoms? of going through menopause, irregular cycles, that's the number one. You're going to notice your cycles are either more often, which is not fun, or less often. So they could vary. You could have a cycle for 2 months in a row and not have one, and then have one for 3, and then it's so much fun. Vaginal dryness, that can be just vaginal itching. So dryness isn't always like that dry feeling. It can be itching, okay? Hot flashes, y'all had hot flashes? Holy smokes. You'd just be sitting there and all of a sudden you're like, woo, what is going on here? Not a good time at all. Sleeping problems, ladies, after I had my hysterectomy, I would toss and turn. I would wake up soaked to the bone. Mood changes. Some of us are pretty excited about menopause and actually didn't do too bad of a mood change, but some women flip that coin and they get really kind of irritable and grumpy because of the estrogen levels dropping. Some people can have weight gain. Our metabolism naturally slows as we get older. So we don't need to eat as much food because we have a slower metabolism, so our bodies are just humming along. Thinning hair, dry skin. That could also be a symptom of hypothyroidism, thinning hair, dry skin, fatigue. So if you're really struggling with this, it is time to come see your provider because there's some things that we can do. We can run some labs. We can kind of see what's going on with you metabolically to see where you're at. And then loss of breast fullness, right? You've seen those commercials, right? Where the ladies are like, down we go. Gravity, oh! We also have some changes in our periods. That's the first one. Your periods could be longer or more regular. They can be shorter. My cycles were pretty regular, 3 to 4 days. And then when I started going through my change, I noticed, it's coming every 14 days and it's for 7 days. Okay, so there's just a lot of things. Mood changes are normal. Okay, and tell your gentlemen, tell your husbands, tell your friends, like, okay, if you're noticing a mood change in me, tell me. I may bite your head off about it, but then I'm going to think about it. And I'm going to say, okay, all right, I get it. I am more moody. Heavy bleeding. I was not a bleeder. I bled like a stuck pig when I noticed I was starting to go through menopause. Some spotting. Again, you have one time of your life when you have those cycles, right, every month. And then if you go through menopause, even if you spot at month 6, you have to start that clock over again. And again, no periods resume after more than a year. Again, those hot flashes, they're just fun. They're sudden feeling of heat. You can have some hot flashes, some splotches on your chest right here. Heavy sweating and cold shivering. I woke up with that. I constantly woke up with that. What can we do naturally to help these hot flashes? There is a couple of things we can do. Black cohosh is a natural herbal. I'm a nurse practitioner. I love herbals, right? Black cohosh. It's actually in estrogen. It's over-the-counter estrogen or remifemin. Estrogen comes in a couple of different formulas. If you're having trouble sleeping, they add a little melatonin in it. It's estrogen nighttime. If you have a little energy issues, it adds B12 in with the black cohosh. Again, maintain your healthy weight, get exercise, and avoid estrogens. Doctors used to prescribe estrogen all the time. You've heard of Premarin, right? Everybody's heard of Premarin. That actually increases our risk of breast cancer postmenopausal. So if a woman comes to me on estrogen, I say, why? Let's talk about this. Because it's not something I like. I love my women. I love my patients. I don't want their boobs to kill them, right? So estrogen is not a really good thing after menopause. So insomnia, we talked about it again. Try to do some melatonin if you need to. That is a natural remedy, super, super common. And then sleeping tips, I think we talked about those. Get a regular sleep, no screen time, no screen time at all. Read that book. Vaginal health. After menopause, our vagina kind of dries up a little bit. Okay? It can make intercourse very uncomfortable, right? So there are some natural things. Replens is a very nice natural lubricant. There is some KY lubricant that we can use that does really help a lot. Feelings about sex could be changing. Some women say, I'm good. And then some women feel much more free because they can't get pregnant. Okay? It's individual. Everybody's individual. I love this group right here. I'm loving their little smiling faces at me. I'm telling you all about it, girls. So again, you may be a little bit more moody or more irritable. We don't know why it happens, but we really do think it's related to those estrogens and the progesterone levels falling. Talk with your primary care provider, please. There's things we can do to help you. There's some labs we can run to help you out and figure things out for you. You don't have to struggle and suffer, okay? And now breast cancer. Yay. It is this one of my best friends is actually going through breast cancer right now. She's 38 years old. It's terrible. It's terrible. October is breast month, and it makes me really happy. I wear pink constantly, but really I do in October. Oops. So symptoms. What are symptoms of breast cancer? A new lump in the breast. Breast tissue goes up here into our armpits. So make sure when you're checking any new lumps in this area or in our breast itself. Thickening. Skin changes. So when you look at your breast, make sure you're putting your arms up and looking at your breast in the mirror and making sure there's not an orange peel appearance. And this really does look like an orange peel, okay? I had a lady come in, she's 32 years old. She's like, I got a little spot right here. I took a look at her breast and my heart sank because I saw that orange peel appearance and it was tugging. And it was right, it was breast cancer. Any pain in the breast is not normal, okay? Just know that. Pain in the breast is not normal. Risk factors. Getting older. Yay. It's better than the alternative, right? Aging is better than the alternative. But that doesn't increase our risk factor. That decreased estrogen. We have genetic mutations, so some of us are. You heard of Angelina Jolie. She had that mastectomy because she was BRCA positive. So if you have a long, very strong family history, I would consider maybe getting a BRCA test just to make sure that you don't have that gene. Having dense breasts. If you've heard on your mammogram, if you've read when they send you those results that you have fibrous, dense breasts, that's an increased risk. That's why we watch those women very, very closely. Family history of breast or ovarian, primary relative, so mom or sister. We watch you very, very closely. Please, please, please get those mammograms. Don't be afraid of them. They have come a long way, ladies. I've been getting it for 13 years, 14 years now, and from then to now, my last mammogram didn't even hurt. Nothing. And I don't have very big breasts, so they have to take basically a rib and a clavicle and get enough in there. And it didn't even hurt. It didn't even hurt. So I was very pleased about that. So let's see. Risk factors we can change. Again, we need to be more physically active. If you're not very physically active, start. It just takes a few steps. Start taking those walks in your subdivision or your streets, or go walk around the mall. Just a little bit of physical activity helps a lot. Being overweight, having obesity after menopause increases our risks. Reproductive history, having our first pregnancy after the age of 30, or not breastfeeding, feeding, or never having a full-time pregnancy actually increase that risk a little bit. Drinking alcohol, so heavy alcohol use also increases that risk. And there's that mammogram, okay? They touch your boobs. You've had a mammogram. They touch, right? Who cares, right? Because I want to make sure that my boobs are not going to kill me, okay? Don't wear deodorant or perfume that day. If you do, they'll give you some wipes to wipe it off. Don't wear a dress. That was a big one because they give you this little half sheet. So don't wear a dress that day. You might be a little more embarrassed. And then what if your mammogram is abnormal, right? As a provider, if I get an abnormal mammogram, I personally am calling my lady, and I'm going to say, hey, they found a little spot in your breast. They're not sure what it is, if it's a cyst or something, but they need to take a better look. So I'm going to order a diagnostic mammogram. So you go back on just that breast that they found, and they don't squeeze a little harder, but they do a little bit more in-depth look at that area. If then that comes back abnormal, they'll tell you right then. The breast care centers in this area are amazing. They will tell you right then. And then they will schedule you for a biopsy, okay? I would say probably only 25% of my biopsies come back positive. So if you have to have a biopsy, don't be scared. Number one, don't be scared because you don't know what you're fighting, but don't be scared because really most of them don't come back positive, okay? All right. Any questions, ladies? All right, so I got just 1 minute. So I do work at Oak Street Health. I am going to plug that just a little bit. Oak Street Health is for Medicare patients only, okay? So Medicare Part B, I've been a provider now for 7 years. I've been a registered nurse for 22, so 30 years. And, sorry. was growling at me. So Oak Street Health, we specialize in the older female, right? You're 65, you're not old, you don't look old, but our bodies are 65 and older. So we actually take our time with you. We have very long appointments. We deep dive into diagnoses with you. We make sure, and I do mean we make sure that we do prevention with you ladies. I love my job. God placed me at my job because my heart is in prevention. I want to prevent you from having a heart attack and stroke instead of taking care of you after. I can certainly take care of you after, but I don't want you to have it in the first place. Yes, ma'am. So we have 2 locations right now. There's one on the west side of town where the old Martins used to be, so in LaSalle Park. And then that one's in South Bend. And then I work at the one in Mishawaka. We are on the corner of Grape and McKinley. Right next door to that Starbucks. I am in so much trouble. It's amazing. This place is truly, truly amazing. They're doing such good work. And it just makes my heart so happy that we can touch lives. And Lillian, as a provider, I know we were just talking. We love touching lives. We love taking care of our patients. And if you have a provider that feels like you're pushing you out or you feel dismissed, that is not the provider for you. It is not the provider for you. If your provider doesn't like to ask you to ask them questions, that is not your provider. Okay? Again, we are queens. We want to know about our bodies, and they are temples, right? We take care of our bodies, and we want to take care as providers. We want to take care of you. All right.
Susan, thank you so much. Thank you, thank you. We have a little gift, I know, just in case you have to slide out. I wanted to make sure from the royal ladies that we give her something. Thank you so much for coming. Thank you so much for taking the call, and I pray that you guys were listening. I say whatever information that you hear, if you don't need it, you know someone that you can share that information to. So never sit there and think, oh, that's not for me. I'm just going to scroll on my phone. Listen, because you can help someone else. You know someone who's got a teenager. You know someone who's got a mother who could be going through menopause. You know someone who maybe has been affected by breast cancer. So there is no information that goes to waste. And we just want to say thank you so much. She's going to have, if you want information about Oak Street, she'll leave it up there. You can pick up and look at it. So thank you so much, Susan. You're welcome to sit for a little bit longer if you want to, but I know you had to leave.
A brand new puppy.
Oh, yes,
And
that's right.
She is angry. I put her in the cage. So thank you, ladies, so much.
Thank you so much.
Beautiful women.
Yes. And before you